Yeah, I think the most important point is how does the presence of CHIP impact the treatment that they're going to receive, number one. Number two, how does the treatment interplay with this mutation in terms of their response to the therapy for the solid tumor, but also what does it do in terms of increasing their risk for developing either hematopoietic dysfunction or blood cancers. So to give you an example, if a patient comes in with a solid tumor and we detect CHIP in a gene, for example, TP53, we have to carefully weigh what type of treatment they're getting for the solid tumor because it may allow the P53 clone to grow. It may cause impairment in how much dose of the drug they can get. It can cause cytopenias, which is low blood counts. But what we've observed in some of these patients in short duration, so less than 2 years, patients are developing MDS and AML, which is often not treatable in them because of how high grade it is.